Pharmacotherapy of acute myocardial infarction. Antiplatelet agent like aspirin 162 milligram or 325 milligram orally, chewed and swallowed, is administered at once to a patient with suspected or definite MI. If the patient is allergic to aspirin, clopidogrel 300 milligram is administered. Antiplatelet agent should be continued once daily. So, antiplatelet drug aspirin 162 mg or 325 mg orally. If allergic to aspirin, then clopidogrel 300 milligram. Antiplatelet agents like aspirin and clopidogrel. Antiplatelet agent should be continued once daily. Analgesia. Intravenous morphine 100 milligram for relief of pain. Intravenous morphine 10 milligram for relief of pain. Intravenous morphine 10 milligram for relief of pain. Antiemetics like promethazine 25 to 50 milligrams slowly, 25 to 50 milligrams slowly, IV, slow IV to prevent opioid induced vomiting. So intravenous morphine 10 milligram to relieve pain. Antiemetics like promethazine to prevent opioid induced vomiting. Intravenous morphine 10 milligram, and to prevent morphine induced vomiting we can use antiemetics like promethazine 25 to 50 milligram. Nitrates like intravenous nitroglycerine for recurrent or persistent pain and to treat left ventricular failure. For pain and to treat left ventricular failure, intravenous nitroglycerine for recurrent or persistent pain and to treat left ventricular failure. Low flow oxygen therapy 2 to 4 liter per minute if there is decreased oxygen saturation. Low flow oxygen therapy. Reperfusion therapy. Primary percutaneous coronary intervention or thrombolytic therapy. Primary percutaneous intervention, primary coronary intervention, primary percutaneous coronary intervention if facilities are available, or thrombolytic therapy like streptokinase, alteplase, tenecteplase, ritiplase, or urokinase is used to restore coronary patency and reperfusion of the infarcted area. Reperfusion therapy by either primary percutaneous coronary intervention or thrombolytic therapy like streptokinase, urokinase, alteplase, tenecteplase, and ritiplase to restore coronary patency and reperfusion of the infarcted area. Reperfusion therapy में primary percutaneous coronary intervention and thrombolytic therapy like streptokinase, urokinase, alteplase, tenecteplase, and ritiplase. Anticoagulants. Low molecular weight heparin or unfractionated heparin. Low molecular weight heparin or unfractionated heparin is given to prevent reinfarction and thromboembolic complication. Low molecular weight heparin or unfractionated heparin is given to prevent reinfarction and thromboembolic complication. Beta blockers should be administered during first 24 hours unless contraindicated. They prevent reinfarction, arrhythmias, and reduce mortality. Beta blockers should be administered during the first 24 hours because they prevent reinfarction, arrhythmias, and reduce mortality. ACE inhibitors like ramipril or angiotensin receptor blockers like valsartan. ACE inhibitors and angiotensin receptor blockers are administered early to improve survival. Statins like atorvastatin should be started to reduce thrombotic events and reinfarction. It is a secondary prevention. Statins like atorvastatin should be started to reduce thrombotic events and reinfarction. Acidosis is treated with intravenous sodium bicarbonate. Pharmacotherapy of acute myocardial infarction. Antiplatelet agents में aspirin 162 mg and 325 mg, clopidogrel 300 mg, analgesia के लिए intravenous morphine 10 mg and promethazine to prevent opioid induced vomiting. Nitrates में intravenous nitroglycerin for pain and to treat left ventricular failure. Low flow oxygen therapy. Reperfusion therapy में primary percutaneous intervention or thrombolytic therapy like streptokinase, urokinase, tenecteplase, retaplase and alteplase. Anticoagulants like low molecular weight heparin and unfractionated heparin to prevent reinfarction and thromboembolic complication. Beta blockers should be administered during 24 hours, during the first 24 hours. ACE inhibitors and ARBs. Statins, and to prevent acidosis, to treat acidosis, use sodium bicarbonate, intravenous sodium bicarbonate. So the mnemonic for acute myocardial infarction pharmacotherapy is MONA-BATS. M for morphine, which is a analgesic. M for morphine, which is used for analgesia, intravenous morphine 10 mg. O for oxygen, low flow oxygen therapy, 2 to 4 liter per minute, low flow oxygen therapy. N for nitrates, intravenous nitroglycerin for pain and left ventricular failure. A for aspirin, which is an antiplatelet agent. If allergic to aspirin, then clopidogrel. M for morphine, O for oxygen, low flow oxygen therapy. N for nitrates, intravenous venous nitroglycerin. A for aspirin. B, then BATS. B for beta blockers. A for ACE inhibitors, angiotensin receptor blockers, and anticoagulants. ACE inhibitors, ARBs, and anticoagulants. So there are three from this A. ACE inhibitor is ARBs, that is angiotensin receptor blocker, example valsartan, and anticoagulants like heparin, low molecular weight heparin, and unfractionated heparin. T for thrombolytic, thrombolytic like streptokinase. S for statins, example atorvastatins. Okay, इसके अलावा primary percutaneous intervention is done for reperfusion therapy and to treat acidosis, intravenous sodium bicarbonate. The mnemonic is MONA-BATS. M for morphine, O for oxygen therapy, low flow oxygen therapy. N for nitrates. A for aspirin, which is an antiplatelet drug. If allergic to aspirin, use clopidogrel. B for beta blocker. Then A for ACE inhibitors, example ramipril. ARBs, example valsartan. Anticoagulants, example low molecular weight heparin and unfractionated heparin. T for thrombolytics, example streptokinase. S for statins, example atorvastatins.